Good morning, everyone. Welcome to this week's episode of Two Teacher Tuesday with your host, yours truly, Dr. Stephen Zahm. Today we are doing yet another episode of Oral Pathology Corner. Today's topic is a somewhat common condition that we see in patients. In fact, there's probably more patients out there that have this and don't even realize it, but it's a condition called Lichen Planus. Basically, to give you the brief rundown, Lichen Planus is an inflammatory condition that we don't fully understand. It gets its name because one of the main symptoms is actually not oral health related at all, but one of the common signs of Lichen Planus is getting a little rash of purple plain like dots kind of splotching around the wrists, ankles, and other areas of the body that kind of looks like a rash. That's where it gets its name from. But obviously most of your dentists aren't going to be looking at your wrists or ankles. So it does affect the oral cavity as well. And it affects everybody a little bit differently. But typically the usual presentation is going to be kind of red and white intermixed, kind of a red background with a white kind of almost spider web or fishnet over the top of it. Looks a little something like this. And the actual rash that you see sometimes on the ankles or wrists looks a little something like this. And so that's kind of the usual presentation of Lichen Planus. Like I said, we don't fully understand what causes it. It does seem to be some sort of autoimmune inflammatory reaction, similar to something like you think of something like lupus. Some research links it to possibly being related to some kind of allergy. In fact, there's an entirely different condition that looks similar that is an allergy to certain medications. But other research suggests that it may be stress related, and in fact, in patients of mine that have Lichen Planus, usually during periods of stress it gets worse. And what I mean by that is that red and white patch that you see sometimes can be completely asymptomatic. Some people don't even know they have it there. But when it flares up, especially during periods of stress, it can kind of become more erosive and painful. And that's when people really realize that they have something going on. But it's, like I said, not common but not rare diagnosis. And with the classic presentation, all those signs and symptoms make it pretty easy to figure out what it is. As far as treatment goes, there's no cure for it, but since it's usually more of just a occasional spell of soreness of the gums and cheeks that are affected, usually we just treat by prescribing some kind of topical ointment. You think of something like Oragel. It's not Oragel, but kind of the similar idea, topical ointment that can be applied to the affected patches, and it kind of soothes that and calms down that inflammation. And so that's basically the gist of Lichen Planus. Hope you found this helpful, and perhaps if you've experienced some of those symptoms yourself, maybe that gives you a clue as to what's going on. So like always, if you find something like that in your own mouth, definitely have a dental professional check it out, because we've talked about other previous topics of other things that can be red and white, anything from as minor as just a little canker sore to something as serious as oral cancer. So don't ever assume It's just Lichen Planus. It'll get better on its own. Definitely get it checked out. But that's it for today's topic. We're a week away from Halloween, so who knows what kind of spooky surprises we might have for next week. So tune in next time to find out. Until then, everybody, have a great week. We'll see you soon.